Okay. We did not use the software because at the time the software was not working adequately enough. Nobody wants to hear my frustrations with the software. But we did use the templates resulting from what the software was supposed to do. We extracted the information from the articles that we did end up choosing. 12 of those studies were quantitative, 1 was qualitative. You might say, well, why did you do both? Because, and let me just rephrase that, we could have done a study right now on the qualitative and had 1 study, and that would have been easy, and we could have written that up in no time, and it would have been great. But to us, the question was about the meaningfulness of the experience that went across psychological boundaries. And the quantitative had just as much to give us that backed up the qualitative as anything else. So why not go ahead and put it in 1 article and do a mixed method design instead of doing 1 with qualitative and then coming back later with the quantitative? That was the question that JBI asked us, and we came back to them and said, we would rather do it the hard way and put them both in the same than to do 1 and then come back with the other later. So that's what we're doing right now is answering some questions that they have about the 2 blending, and we should have that review into them in the next couple of weeks. Interestingly enough, the pictures on the left are people that have survived lung cancer, which is really fun to see that there are some pictures of people still out there today that have survived. And all 3 of these have survived past 8 years, which is awesome. And their reports on the web are really, really positive reports. So when you get to some of the results that we have today, this is why they're probably living out their dreams, is because they've done some things to actually make some changes that would help, as well as psychologically they've made some changes that have helped. In this particular qualitative study, the only one out there, which is a really cool study, 29 participants from 142 enrolled in the study. Of those 29, they were separated into not distressed or distressed, meaning in thought. So psychologically and emotionally, did they feel distressed from this whole ordeal, or did they feel positive, optimistic, outgoing as a result of the ordeal? They looked at how did they learn about their diagnosis, the hospital and recovery time, when and how they returned to normal life, how their experience changed their outlook on life, and then the balance of the negative and positive. What you need to know is a lot of this we could not use because it didn't go to our question. We were looking for what was that experience of living past 2 years and the meaningfulness of that. What did we actually learn from that? And so here are the subcategories. You see theme 1 is the existential issues concerning challenged life. In the subcategories for this, if you've ever done qualitative, you have to take a bunch of interviews, bring them all down to a specific number of themes that tend to keep coming back time after time after time, and then identifying the different pieces that go within each of those themes. So in this case, there were 5 themes, of which I eventually, when we get to the end, you'll see that I'm down to 4 themes, because I'll tell you that 2 of the ones in the middle actually go to the same piece. They just tried to make it more detailed, but it really goes to the same thing. In these subcategories, you see appreciation for life, a changed outlook, loss of normality, and inner feelings about self. Now, I'm going to talk just a little bit more. The appreciation for life, living life to the fullest is one meaning of that particular area, but so is increased focus on the little things in life and looking at every day as a gift. Now, those were things that people turned in their head to be more positive for them in that area. The changed outlook, just enjoying life, also had to do with living life to its fullest, being more positive, and on a not side, saying not worrying so much about the little things and being more satisfied. So you see it keeps coming back as a picture there. Loss of normality, what they could not do anymore. This was the more negative, and it came out from the distress group. These are the ones that kept talking about what I can't do. I have negative psychological issues. I'm damaged for life. I'll never be able to do things the way I used to do them. Poor me, poor me, poor me. And I'm literally taking this to a place of, being over here, the same person with the same problems and the same issues and the same pains and the same everything would say, I came so far just by this experience, and I've learned so much, and I'm doing so much more from it. And then you have this individual, well, I'll never be able to do things like I used to. It's a very interesting dynamic between two different people that were going through very similar results. And one's going to live and one's not. Which one? The one with this is going to live less long than the one that has the other attitude. Inner feelings about self, the feelings of usefulness, even going through this, knowing that they still play a part in their everyday lives with family, with their jobs, or with even in social parameters, as long as they feel that they have an importance there and a usefulness, they're doing good things. Theme 2 had to do with health and self-care. This particular area, I laugh because this one particular article, the main message was quit smoking. I mean, that was it. And you know, you have to go through this long ordeal of answering all these questions, and then there's this place at the end of the template that says, is there anything else you want to add? I wrote on the bottom of it in screaming letters, just quit smoking is all I could put on that form, because that's what the article kept saying over and over. Well, Susie gets this form from me, and she goes, is that all it said? And I said, basically, that's all it said is quit smoking. Well, now it's showing up even in the interviews. It was like, if you're going to live out life, you better quit smoking. And this was one of the things that was the message from that. And to stay away from people who do. That was also a very important message. Greater appreciation for, and this is where you're going to see where the qualitative piece came out, and you'll see later where they did some physical activity questions in a quantitative sense that give you the same kind of message that they gave you just from an anecdotal perspective. But eating better, exercising regularly, and not taking unnecessary chances. All key areas in this particular area. And then, guess who's distressed again? No control of health. So everybody else is saying, hey, you do these things, you're going to feel better, do better, and move on. And then you got the distress group coming back with a negative here. Theme 3, physical ability. These are the two that you could lump together, the theme 2 and theme 3 for when I talk at the end. But loss of physical ability, here's your distress group, overcame loss of physical activity, the non-distress group. You start to see this pattern over and over and over again. Comorbidities, I'm sorry, I misspelled. Man, oh man. Anyway, if you have too many ill effects, I'm going to talk in a little bit, just in a few minutes, about what we call a synergistic effect with clustering of symptoms. These comorbidities can cause that, and it could be pain, it could be lots of different physical issues going on, as well as lack of physical activity because of maybe nausea, things that are going on with radiation or chemotherapy and things of that nature. Theme 4, adjusting change into one's life, huge category, probably one of the most important that they talked about besides the first one. And this is accepting and changing life to accommodate decreased physical ability. And then the other side of that, guess who? Distress group, gloom and doom for life after illness. All they could talk about was how bad life was. Theme 5, giving and receiving support. I want you to realize it's not just receiving support, they need to give support. And this is a huge message that I don't think people think enough about, that really came out in this particular qualitative study, that they need to give as well as receive, or they don't feel like they're being useful, which goes back to number